Hi, everybody. This is Dr. Sonia McGowan with Covenant Pediatric Wellness Center. And I'm so glad you're here. And you're going to be glad you're here too, because we are with my very special person, Brittany Wade. And we're going to be talking about her and her family's journey with autoimmune encephalitis slash PANS slash PANDAS. It's been quite a road, and we're going to talk all about that. So, Brittany, hi. Thanks for coming and welcome.
Thank you. I'm excited.
So tell us about your life. Tell us about your husband, your kids, your job. Tell us everything.
Sure. I'm a physical therapist assistant by trade. I've been doing that for 14 years and love it. I'm married to my husband, John, and we have 3 kiddos, Lucas, who is 8, Olivia, who is 6, and Jackson, who is 4. We like to garden, ride 4-wheelers and dirt bikes, anything outdoors. We like to do. So that's kind of our niche as a family. So,
And chickens. You
chickens,
love your chickens.
yes. That's mostly me.
Yeah. All right.
Everyone
So
else is just kind of drug into
it. So how did you find us?
Actually, like I said, I work in physical therapy. And so I knew Liz Reckers, who is the occupational therapist assistant or the occupational therapist here. And I had seen her post and share some things about you all. And I'm like, well, I don't want to medicate my kiddo for his ADHD like symptoms. So what the heck? I'll give it a shot. If it works out, great. If not, it's another thing that didn't work. So what's new? So I decided to Google search, look at the website. And then I actually looked at it one time and like, okay, this is it. I'm going to pull the trigger, make the appointment. And I'm so glad I did in 2022. So it's been a long journey, but we wouldn't be as far as we are in our journey of healing if we hadn't started here back then.
So what kinds of things were you seeing with Luke then? Like what was making life hard for your family?
Oh my goodness, lots of things. And things that started as early as 2. So when we first came here, he was about 5, and we were like, there's no way we can send our kid to kindergarten. He doesn't sit still. He's not kind to people. He can't control his emotions. He flies off the handle about things that, don't normally provoke that emotion. And I knew that, like I said, as early as 2, that something was different or wrong or off. And so I have a friend who was eliminating food dyes from her kiddo's diet. And she, gave me these books and gave me all these resources online to research for myself. And so that was our first step, was eliminating food dyes when he was 2. So we've been doing that for 6 years. So I feel I feel like a veteran in that department, while still a newbie in some of these other things that we're experiencing.
So when someone said, hey, think about taking dyes out of his diet, was your first thought, oh, that sounds pretty smart? Or was it, what the heck? That's crazy talk.
I mean, I've always been someone that's the different person or the against the grain kind of person. Never really going with the crowd or, doing whatever, mainstream or everyone else is doing. I always wanted to kind of do things differently that were best for my family versus what everyone was doing. And so I started researching the gut-brain connection. And so that kind of triggered me to really commit to removing the food dyes as a first step.
And how did that go? What sorts of changes did you see?
We saw a pretty, almost, I wouldn't say immediate, but a very quick turnaround in some of his mood and behaviors. He was a biter. He loved to bite people. He got kicked out of several daycares for biting. And, the aggression was way less. And what, prompted me to pursue further investigation was that the symptoms were less, but they weren't gone. Mm-hmm. So while I knew it helped, there was still something at play that we hadn't discovered or addressed yet. So
Got it. So you started working for us, and well,
mhm.
first you came in as a patient, and and
Yeah.
sort of tell people what we did to get you started.
Mhm. Um, get started here, you mean?
Yeah.
Oh, yeah. So we came and brought Luke in July of 2022, and I remember being at the play place at the mall, telling this mom about the testing, what we had found out, and the things we had started and tried, and how they were helping. And I was just a free walking billboard for Covenant. Um, and then you guys, were gracious enough to give me the opportunity to do something I have no skills in. I have no training, no education in marketing or advertising. I just have the gift of gab, and I am very passionate about researching and educating people. So that's mainly where my strengths come from for a position that I didn't have skills from. So, and then from that, I've transpired into other things, and I still love to get to talk to parents when they first call and get their patient's the child's information and hear their story. And many of them are very similar to ours as a family, and it's very encouraging for them to hear someone on the other side or further along in their journey to say, hey, we've been where you're at right now, and things do improve, things do get better. Like, this is just temporary. And there is still hope that your kid can return to the normal kid that they were prior to whatever it was that happened.
So let's jump in and talk about autoimmune encephalitis. Okay. So for people who
Mhm.
don't know, autoimmune encephalitis, um, you also hear it called PANS and or PANDAS. If it's caused from strep, we call it PANDAS. If it's caused from something else, we call it PANS. So how did you kind of end up in this autoimmune encephalitis world? Like, what were his symptoms? What have you done? Just kind of talk us through how this has all evolved for your family.
Yeah. So, like I said, we started here in July of 2022 and found lots of things, that were at play for his mood disorder, his behaviors, his just things that were quirky that we thought about him that we didn't really think were anything significant. And at that time, we couldn't tolerate him getting a blood draw. He couldn't tolerate. Neither could we, honestly. It was very traumatic for all of us to experience through his lifetime. Um, but we did all the easy testing, if you will, that didn't require a blood draw. But again, there was just still some missing piece that we hadn't found yet. And so I literally, like, one day was like, today's the day. Like, we have to get his blood drawn no matter what. Like, I don't care what it takes. We're doing it. And that was just a year ago. That was in January of 2024. And so that was kind of the missing piece where it showed, PANDAS concern with his labs. And so the things that were kind of related to that were, the behaviors that were just not normal or age appropriate, and also that weren't appropriate for the situation. So, he was enraged about something that was very minor or not even a deal at all. He was very anxious. Most kids have like separation anxiety. His anxiety is about like going into public places, even if he's with us, but leaving the house, even though he's going to places he enjoys going to, the getting out of the house part, was the more difficult part. He, at his worst, was having visual and auditory hallucinations. Again, things that aren't normal for kids his age, or anybody actually. He would make this awful squealing sound, and we thought he was just, playing around or being silly. And then looking back, I'm like, was that actually a vocal tic that we didn't really put two and two together until now that we're, later down the road? He, at the worst, it was hard for him to go to sleep because he would close his eyes and he would see these things. And so, between you and Dr. Strong and my love for researching, I wanted to pursue something further because I thought something, deeper, more serious was at play as a result of the PANDAS. And so I actually was reading a patient chart here, and a mom was telling her story about her daughter and how she was having nighttime seizures, and what she was explaining them. And I'm like, oh my gosh, this is when all these things are happening for Luke, is that, right when he's going to sleep, from the awake to asleep period, and then through the night as he wakes up. And so I then went to work my PT job the same week and met a gentleman, and he was like, oh, I'm here for seizures. And so the whole week, seizures kept coming up. And I'm like, okay, well, what does this look like, in relation to his diagnosis? And sure enough, we got referred to neurology, who, based on Luke's symptoms and him describing the things to her, she pinpointed on the brain model, like, this is exactly where he's seizing based on these symptoms. Wow. So that was pretty unique. Yes. And so we did, further testing and imaging. And she was like, well, because his immune deficiency that we had no idea about until things got out of control and then triggered this autoimmune response. It's been, a new diagnosis after a new diagnosis that we've missed. And I mean, all of the medical professionals that he's seen for 8 years.
Yeah, because it's not like you locked him in the house and never took him to the doctor. Like, you've pursued tests and treatments with, for him. Did you have, so how did you just luck into this neurologist who is PANDAS literate?
There was actually a patient here who had recently started seeing, her name is Dr. A, now Dr. Dyer, Columbia, Missouri. And I had the information for a while before I decided to call her. And I just didn't want to try another doctor. I didn't want to go through the whole, jump through this hoop to disprove this or whatever. And then it end up at a dead end again. And so it wasn't actually until he started having the hallucinations that I finally was like, okay, this is something serious that needs, someone to actually further investigate the brain component of it, because this isn't a psychiatric disorder. This is not my kid being bipolar or schizophrenic. Like, this is something more than that, because 8-year-olds shouldn't have those diagnoses.
Right. So if we back up a little bit, we often talk about the triggers for autoimmune encephalitis. Often it's, a bacteria or a virus. We finally got blood. We did some urine testing. We did all kinds of things. What are Luke's triggers? Is it strep? Is it a virus? What is it?
So Luke's triggers are strep, mycoplasma, which is a new finding, Epstein-Barr virus, mold, COVID is a new finding. And of course, there are a plethora of other untested things that we could, pursue. But I think what people don't realize in general is that every exposure to those pathogens just ramps his, immune response back up. And when that happens, then that also increases his seizure rate or risk of seizure rate. So it is very important that, and I've stressed this a lot now that I've known for a few months about his immune deficiency, that if your kid is sick, even if they don't appear to be externally, horribly sick, if there are symptoms, like, all of these children who are at risk for, being exposed to these pathogens could have serious health complications and results from just I mean, a 10-second encounter, where and you forgot. So, I mean, even the tiniest exposures are a huge deal.
Yeah. Yeah, because part of the whole autoimmune encephalitis presentation is what we call a relapsing remitting course. So kids will get symptoms and then they'll get better and then they get symptoms again. And, those flares can be very difficult to manage. So if your kid's sick, keep them home, right?
Mhm.
Yeah. So tell me
Yeah.
about how how you're navigating his current medical providers, insurance, what treatments he's taking. Like, tell us about that end of things.
It has been a nightmare, to be honest. I mean, the appointments alone, managing all the providers, getting him out of school to go to the appointments, me leaving work to go to appointments, traveling, to St. Louis and City, Columbia. There's a lot of travel time. There's a lot of time away from work and school. So that in itself is a difficulty. But then it came to the insurance component, and that was a whole new rodeo. There were so many hoops we had to jump through just to prove that this treatment was medically necessary. Excuse me. Our daughter had to have a peer review. It was still after that, I had to actually appeal it myself in addition. And then I had to request an outside provider to basically review all the medical documentation and the treatment plan to make sure that they also agreed that this was medically necessary. And thank God we had someone with a brain in Utah who confirmed that this treatment is, medically necessary for his condition. And they were able to overturn the insurance denial. So he was able to start treatment, I guess, in December. He started IVIG infusions at our home.
So tell people what IVIG is.
IVIG is intravenous immunoglobulins. And so essentially, you've probably seen these donations clinics around town. There's some locally in Jeff City, Columbia, Missouri, where you can go and donate plasma. And so what these centers do is they take the plasma that you donate and they turn it into medicine, if you will. And they, highly process it, clean it up, and get the good things out of it, and then turn it into this infusion that essentially gives Luke someone else's immune system because he doesn't have one. And so the theory is that when he gets the infusion, the other person's immune system helps him start fighting off the pathogens that are running rampant in his body and causing his.
And so has he had a good response to the IVIG? Oop. Hold on, everybody. I think we're lagging here. Just give us a second and we'll let
He has, thankfully. It's not the case for everyone. He has not had any ill side effects. There are a plethora of them that he could experience or that some people do experience with the infusions. The worst that he's had has been managed with ibuprofen. So other things that could have happened is that he could have had foreign, substance, someone else's cells, an immune system coming into his body. Because it is not known by his own cells, he could have developed aseptic meningitis, neck pain, headache, and requires medical attention to see pretty quickly that it was helping with his mood and just his general, well-being.
And so how does he tolerate the needle stick? Can you hear me? Brittany, can you hear me?
I can hear you now.
Okay. So we know that Luke does not love needles. How does he deal with the IVIG infusion needle sticks?
Right. Oh, it's great. We numb him up about an hour before the nurse is to come. Thankfully, we have a nurse that comes to our house. We don't have to go to an infusion center and risk exposure to, more nastiness and people. And just sometimes for Luke, the exposure when he isn't feeling safe or when he's anxious, the more people make it worse. And people are watching him. And so then that, makes it even more worse. And so we numb him up about an hour before. It takes 2 people plus the nurse. I've learned a technique from here, from the blood draws that we use for him. Our friends or family members will hold his arm straight, and then the nurse will start his IV.
Okay. And how long does an infusion usually last?
It's about 5 hours per
Wow.
infusion.
So he just has to lay around and watch TV, hang out with the needle in his arm while he gets his infusion.
Yep. He does. Yep.
So
and we were very nervous that, he would be anxious.
So what kind of awareness does Luke have about his own condition? Like, does he understand what's going on in all these appointments? Is he self-conscious about his symptoms? Like, how is he feeling about all this?
I try to approach it from a medical standpoint because that's what I enjoy, is, the medical research and terminology. And I want him to know that this is a medical problem. This is not a problem with him. This is not something that he chooses to have or that he created for himself or whatever. So, I talk to him like he's an adult, because I want him to really know, the mechanics of what's going on. And because we have done that and he has had a taste of what it feels like to be better or to feel well for a short period of time, he can now kind of differentiate and identify like, oh, I do feel better. Like I overall my body feels better. And we've, noticed when he is well, which is unfortunately still a short-lived period, maybe days to a couple of weeks post-infusion, we notice improvements in his mood, his behavior, getting along with people. He's less impulsive. He can just to defend yourself.
So, how has this what sort of impact has this had on your marriage to John, to Luke's siblings? Like, how has this impacted your family dynamic? Can you hear me?
What sort of impact has this had on what?
Sorry, on your marriage and
Now I
your
can.
other kids.
Oh gosh. It's been hard. My other kids have to experience the trauma of Luke's treatments and appointments. They also get attention, if you will, because they're not sick. The appointment's mom, she has no clue that going to the doctor means that you're not well, but she sees that that's time that he has with us.
Yeah. That has to be hard. So if there are families out there who are wondering about autoimmune encephalitis, PANDAS for their kids, and you're at the beginning of their journey, what do you tell them in terms of advice, resources, words of wisdom? What would you say to a parent who's just putting their feet on this path?
Oh gosh. Really, it's most important women, whichever parent you are, that can come alongside of you to really support you, because you're going to need it. You're going to need the extra support emotionally, spiritually, and there are just not worldly things that can help or make it better. And so definitely finding a very strong support group of people. Also, I highly encourage you to do your own research. I know not everyone a good tool that you can use to arm yourself with when you're going to these appointments, where you can advocate for your child. And I will caution you that sometimes when you come with information, they feel attacked. So it's very important to also let them know that this is a team effort. This is not a you against me. I also highly encourage you to get plugged in with other parents who are in the same battle, for encouragement, for sort of, learning the path that they took, the questions that they have asked, because there are so many things that you just to kind of pull you up and alongside of them. There are lots of great books websites, Facebook groups, for more information and to just better have an understanding. It also is helpful if you can educate teachers, coaches, your own families. The more people know about it, the more accepting and receptive they are of the situation that you're going through, versus kind of judging from the outside when they don't really have any idea.
And parents should not be surprised when they go to an appointment to try to get help for their kid and hear a doctor say, "Oh, I don't think it's a real thing. PANDAS isn't a real thing." We have so many families who come back and tell us that major hospitals will tell them that and refuse to help them, which is super frustrating when all a family's trying to do is get some help for their child. Okay. All right. Any closing words? Do we have any questions from the audience before we let you go?
Mm-hmm.
All right. Okay. Any closing words for us, Brittany, before we let everybody go?
I highly just encourage parents to keep researching, to keep asking questions. If your gut tells you that something is not right or that the answer hasn't been found, keep pursuing it because you're usually correct. And if you're not, then so be it. And you've marked it off the list of things that aren't at play. Mother's intuition is, a God-given thing. And it's best if we do utilize it. And also, we know our children best. We spend most of our time with them versus a doctor who sees them for 10 minutes. So you're more thorough and in-depth than a doctor's very short visit.
So Jamie has a great question here. She says, do you use autoimmune encephalitis synonymous with PANDAS, or is there any differentiation? She says sometimes she struggles with explaining this condition to others. So how would you answer that question, Brittany? Did you hear my question? So
I didn't.
Okay, so Jamie asks, do you use autoimmune encephalitis synonymous with PANDAS, or is there any differentiation? How would you explain that?
I would say autoimmune encephalitis is the more mainstream medicine accepted closes the gate as soon as you say it. But if you use autoimmune encephalitis, their doctor brain is somehow able to sort of accept that and understand that versus the PANDAS.
Yeah, I would agree. I think that's a great explanation. So when it feels like when a family goes to a specialist and they immediately come out saying, "Hey, I think my kid has PANDAS," it's you're right. It's just like boom. It's like, nope, that's not a thing. Autoimmune encephalitis is a thing. And so what we're trying to do as a clinic is sort of pivot our language just a little bit, because PANS and PANDAS is autoimmune encephalitis, right? But we need to educate people and use whatever terminology it takes for the child to get help in the mainstream medical world. So it's it's pragmatics, it's semantics, whatever you want to call it. So yeah, they're both PANS and PANDAS are autoimmune encephalitis. It's just the way we use the wording. So, all right. Any last questions from the audience before we move along? Or Brittany, anything else that you've thought of that we didn't cover while we were together? All right. So we've had people from all over the United States on this call, which is great. We've got Kate from Minnesota, and we've got people from Missouri, Jamie, and different people. So thank you so much for joining us. Share this widely with people who you think would benefit from knowing more about autoimmune encephalitis. I'm going to date myself a little bit, but back when I started in the field, when I was in college, autism was 2.5 in 10,000 kids. And I was in the middle of watching the autism epidemic in the 90s, in the 2000s. And now we're at 1 in 36 or whatever it is. And I feel like PANS, PANDAS, autoimmune encephalitis is the next thing, the next epidemic that I'm here to watch. Because at this point, Brittany, you correct me if I'm wrong, but we're getting almost as many PANS, PANDAS cases through our doors as we are autism and other complex needs. And there's just a real drought of services for families and resources for families. And so they come to us from all over the place because we're one of the few literate clinics here who know what we're looking at, know how to test. So while I, under my credentials, technically cannot diagnose this, I can sure start the process of testing, getting the groundwork laid so that you can walk into a neurologist or other specialist with the data you need to hopefully get a diagnosis faster. So here at Covenant, we are specialists in complex kids. We are always taking new patients. I can't imagine we'll ever stop just because the need is there, and that's what our passion is. So if you have questions, Brittany happens to be my patient services coordinator. So she takes all the new intake calls for families who have complex kids. So if you feel like you need an appointment with us, you want to establish with us, you can find more information about us on our website, which is covenantwellness.net. You can also email Brittany directly, brittany@covenantwellness.net, and she can answer your questions, get you in the door, all of that. So Brittany, thank you for joining us and telling us all about Luke and your family story. And, they say that Brene Brown has some sort of a quote that talks about, you can use whatever challenges you went through to light the way for other people coming behind you. So that's what you're doing. So, all right, guys, thank you so much. And we will see you next time. Have a great day.